Introduction. Welcome to the instruction video for Fiasp FlexTouch pen. Please pay attention to this information before you start using your pen. Do not share your Fiasp FlexTouch pen with other people, even if the needle is changed. You may give other people a serious infection or get a serious infection from them.
Fiasp FlexTouch pen, generally referred to as just pen in this video, is a pre-filled, disposable, single-patient use pen containing 300 units of U100 Fiasp insulin aspart injection.
You can inject from 1 to 80 units in a single injection. The units can be increased by 1 unit at a time. People who are blind or have vision problems should not use the pen without help from a person trained to use the pen. Do not use a syringe to remove Fiasp from the FlexTouch pen. To give your Fiasp injection, you will need the following supplies: a Fiasp FlexTouch pen, a new Novo Fine Plus, or Novo Twist needle, an alcohol swab, and a sharps container for throwing away used pens and needles. See after your injection at the end of these instructions. Start by getting to know the different parts of your pen and needle. This is the pen cap, the insulin scale, the insulin window where you can see the insulin. This is the dose counter and dose pointer. Here's the dose selector, and this is the dose button. This is the Novo Fine needle, the Novo Fine Plus needle, and this is the Novo Twist needle. This is the outer needle cap, the inner needle cap, the needle, and the paper tab. In this instruction video, needle handling is shown with Novo Fine Plus and Novo Twist. All other handling situations are shown with Novo Fine Plus exclusively. Now you are ready to go through the steps for how to inject insulin with your Fiasp FlexTouch pen. Preparing your Fiasp FlexTouch pen. Wash your hands with soap and water. Before you start to prepare your injection, check the Fiasp FlexTouch pen label to make sure you are taking the right type of insulin. This is especially important if you take more than one type of insulin. Fiasp should look clear and colorless. Do not use Fiasp if it is thick, cloudy, or is colored. Do not use Fiasp past the expiration date printed on the label or 28 days after you start using the pen. Always use a new needle for each injection to help ensure sterility and prevent blocked needles. Do not reuse or share needles with another person. You may give other people a serious infection or get a serious infection from them. Pull the pen cap straight off. Check the liquid in the pen. Fiasp should look clear and colorless. Do not use it if it looks cloudy or colored. Select a new needle. Pull off the paper tab from the outer needle cap. Push the capped needle straight onto the pen and twist the needle on until it is tight. Pull off the outer needle cap. Do not throw it away. Pull off the inner needle cap and throw it away. Priming your Fiasp FlexTouch pen. Turn the dose selector to select 2 units. Hold the pen with the needle pointing up. Tap the top of the pen gently a few times to let any air bubbles rise to the top. Hold the pen with the needle pointing up. Press and hold in the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. A drop of insulin should be seen at the needle tip. If you do not see a drop of insulin, repeat this priming procedure no more than 6 times. If you still do not see a drop of insulin, change the needle and repeat the priming procedure once more. Selecting your dose. Check to make sure the dose selector is set at 0. Turn the dose selector to select the number of units you need to inject. The dose pointer should line up with your dose. In this example, 5 units are selected. If you select the wrong dose, you can turn the dose selector forwards or backwards to the correct dose. In this example, 24 units are selected. The even numbers are printed on the dial. The odd numbers are shown as lines. The Fiasp FlexTouch pen insulin scale will show you how much insulin is left in your pen. To see how much insulin is left in your Fiasp FlexTouch pen, turn the dose selector until it stops. The dose counter will line up with the number of units of insulin that is left in your pen. If the dose counter shows 80, there are at least 80 units left in your pen. If the dose counter shows less than 80, the number shown in the dose counter is the number of units left in your pen. In this example, there are only 16 units left, so the dose counter stops and you can't dial past 16 units. Giving your injection. Inject your Fiasp exactly as your healthcare provider has shown you. Your healthcare provider should tell you if you need to pinch the skin before injecting. You should take your dose of Fiasp at the start of a meal or within 20 minutes after starting a meal. Fiasp can be injected under the skin, subcutaneously, of your stomach area, abdomen, upper legs, thighs, or upper arms. Do not inject Fiasp into your muscle.
Change. Rotate your injection sites within the area you choose for each dose to reduce your risk of getting lipodystrophy, pits in skin or thickened skin, and localized cutaneous amyloidosis, skin with lumps at the injection sites. Do not use the same injection site for each injection. Do not inject where the skin has pits, is thickened, or has lumps. Do not inject where the skin is tender, bruised, scaly or hard, or into scars or damaged skin.
Choose your injection site and wipe the skin with an alcohol swab. Let the injection site dry before you inject your dose. Insert the needle into your skin. Make sure you can see the dose counter. Do not cover it with your fingers. This can stop your injection. Press and hold down the dose button until the dose counter shows 0. The 0 must line up with the dose pointer. You may then hear or feel a click. Keep the needle in your skin after the dose counter has returned to 0 and slowly count to 6. Count slowly. 1, 2, 3, 4, 5, 6. When the dose counter returns to 0, you will not get your full dose until 6 seconds later. If the needle is removed before you count to 6, you may see a stream of insulin coming from the needle tip. If you see a stream of insulin coming from the needle tip, you will not get your full dose. If this happens, you should check your blood sugar levels more often because you may need more insulin. Pull the needle out of your skin. If you see blood after you take the needle out of your skin, press the injection site lightly with a piece of gauze or an alcohol swab. Do not rub the area. Carefully remove the needle from the pen and throw it away. Do not recap the needle. Recapping the needle can lead to needle stick injury. If you do not have a sharps container, carefully slip the needle into the outer needle cap. Safely remove the needle and throw it away as soon as you can. Do not store the pen with the needle attached. Storing without the needle attached helps prevent leaking, blocking of the needle, and air from entering the pen. Replace the pen cap by pushing it straight on. After your injection, put your used Fiasp FlexTouch pen and needles in an FDA-cleared sharps disposal container right away after use. Do not throw away, dispose of, loose needles and pens in your household trash. If you do not have an FDA-cleared sharps disposal container, you may use a household container that is made of a heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid without sharps being able to come out, upright and stable during use, leak-resistant, properly labeled to warn of hazardous waste inside the container. When your Sharps disposal container is almost full, you will need to follow your community guidelines for the right way to dispose of your Sharps disposal container. There may be state or local laws about how you should throw away used needles and syringes. Do not reuse or share needles or syringes with another person. For more information about safe Sharps disposal and for specific information about Sharps disposal in the state that you live in, go to the FDA's website at http://www.fda.gov/safesharpsdisposal. Do not dispose of your used Sharps disposal container in your household trash unless your community guidelines permit this. Do not recycle your used Sharps disposal container. How should I store my Fiasp FlexTouch pen? Before use, store unused Fiasp FlexTouch pens in the refrigerator at 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius, or at room temperature below 86 degrees Fahrenheit, 30 degrees Celsius. Do not freeze Fiasp. Do not use Fiasp if it has been frozen. Unused pens may be used until the expiration date printed on the label if kept in the refrigerator. If Fiasp FlexTouch pens are stored at room temperature prior to first use, it should be used or thrown away within 28 days. Pen in use. Store the pen you are currently using without the needle attached at room temperature below 86 degrees Fahrenheit, 30 degrees Celsius, or in the refrigerator at 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius for up to 28 days. Keep Fiasp away from excessive heat or light. The Fiasp FlexTouch pen you are using is to be thrown away after 28 days, even if it still has insulin left in it and the expiration date has not passed. General information about the safe and effective use of Fiasp. Keep Fiasp FlexTouch pens and needles out of the reach of children. Always use a new needle for each injection. Do not share Fiasp FlexTouch pens or needles with other people. You may give other people a serious infection or get a serious infection from them. Summarizing the important steps. To summarize how to use Fiasp FlexTouch, these are the important steps. Always use a new needle for each injection to help ensure sterility and prevent blocked needles. Do not reuse or share needles with another person. You may give other people a serious infection or get a serious infection from them. A drop of insulin should be seen at the needle tip when you prime your pen. If you do not see a drop of insulin, repeat the priming procedure no more than 6 times. If you still do not see a drop of insulin, change the needle and repeat the priming procedure once more. Turn the dose selector to select the number of units you need to inject. Press and hold down the dose button until the dose counter shows 0. Keep the needle in your skin after the dose counter has returned to 0 and slowly count to 6. When the dose counter returns to 0, you will not get your full dose until 6 seconds later. Carefully remove the needle from the pen and throw it away. Do not recap the needle. Recapping the needle can lead to needle stick injury. Thank you for watching the instruction video for Fiasp FlexTouch pen.